How's it going, guys? We have a difficult question for Gastro, Step 1, Internal Medicine Surgery, 2CK, 10-year-old boy, 4-day history of abdominal pain, fever, swelling of the face and eyelids, past medical history unremarkable. Recently recovered from upper respiratory tract viral illness. Abdominal examination shows diffuse maltenderness, palpation, and fluid wave. Question wants to know which following most likely etiology for the patient's abdominal presentation. Let's just hop to the answer choice here. Choice A, HUS, wrong fucking answer. So this is going to be a triad. So E. coli, EHEC 157H7, or Shigella, liberating toxin. The triad's going to be number 1, renal problems, quote unquote. So it can be increased RFTs, butyronicreatinine. It can just be red urine where we have normal RFTs. So renal problems, number 1. Number 2, thrombocytopenia. Number 3, schistocytosis. Okay, so you're going to have the toxin causing damage to the endothelium of the renal afferent arterioles. Platelets are going to plug the damage, leading to thrombocytopenia. RBCs are going to fly past the platelet plugs, cause shearing, schistocytosis. The combination of thrombocytopenia and schistocytosis is called MAHA, microangiopathic hemolytic anemia. Wrong fucking answer. Choice B, Hanexually purpura, wrong fucking answer. High yield diagnosis for PEDS 2CK, non-existent on step 1. It's going to be viral illness that precipitates purpura in the buttocks, thighs. So tetrad, that's number 1. Number 2, IgA nephropathy, red urine. Number 3, arthralgias. Number 4, abdominal pain. You need not have all 4 in the tetrad, but that's classic. Wrong fucking answer. Choice C, liver failure, wrong fucking answer. It's not an outrageous answer choice. Obviously, we have what appears to be ascites here. In fact, you do have ascites. Okay, so we have to think about possibilities as far as hepatic insufficiency, cirrhosis, etc., as an etiology for our fluid wave, for our ascites. But we're going to continue looking at the other answer choices for the moment. Choice D, nephrotic syndrome, correct answer. Now, if you think this is obscure or recondite, don't take it up with me, take it up with the NBME exam. It's nearly identical to a question on one of the 2CK forms. Okay, and I'm making this content relevant for step 1 as well. But you need to know that minimal change disease is when you have a viral illness in PEDS classically causing edema. Okay, so it can be ascites, periorbital, pedal edema. Okay, they don't have to tell you that there's a recent viral illness. I actually made it easier by telling you that there's a recent viral illness, just to be very clear and clean cut as far as what's actually the diagnosis here. But this is minimal change disease leading to ascites, and then we have spontaneous bacterial peritonitis as a result. So SBP is going to be where you have ascites plus fever. Okay, so fluid wave, that's clearly our ascites here. And then we can go on a long discussion as far as the management of SBP, which USMLE loves. You're going to do a paracentesis. Don't confuse that with pericardiocentesis. Paracentesis just means aspiration of the fluid of the peritoneal cavity. And then you're going to choose white cell count and differential first if it's listed for the next best step. If it's not listed, go straight to gram stain, culture the fluid. Okay, you need to know that sequence. You're going to diagnose with greater than 250 white cells per microliter, and you're going to give ceftriaxone as classic agent to treat. So let's just hop to, and actually before I do that, just so SBP, okay, it's an important diagnosis, mostly for 2CK, but for those of you studying for step 1, I want you to know it as well. And you can get it with any cause of ascites. Okay, so nephrotic syndrome, as in this case. In adults, it could be anything. Minimal change, membranous glomerulonephropathy. Okay, could be diabetes causing nephrotic syndrome. So any cause of nephrotic syndrome, renal etiology could cause SBP. And of course, our hepatic etiologies, cirrhosis. Okay, Hep B, Hep C, hemochromatosis, alcoholism. So let's just go through the final answer choice here. Norwalk virus, wrong fucking answer. So I mean, obviously, just a miscellaneous distractor being an asshole. Okay, so when we think of viral etiologies for gastroenteritis in pediatrics, norovirus could be correct if a child has gastroenteritis as well as the family, because rotavirus is what we think of under the age of 5. Okay, so if they give you, let's say, a 4-year-old who's not vaccinated and only he or she in the family has watery diarrhea, that's rotavirus. But let's say they tell you 4-year-old's not vaccinated, has watery diarrhea, but the rest of the family, the parents, older sibling as well, they all have watery diarrhea. That's going to be norovirus because patients over the age of 5 aren't going to get rotavirus. Wrong fucking answer. You know the deal. I'm going to make more content. If you like my stuff, subscribe my channel. I appreciate your time. That's it.